So we started the topic skin, that is integumentary system. In that class, we studied about basic things and started about the layers of the skin. So basically, we have two layers, that is epidermis and dermis. So in the epidermis, we have more than 4 to 5 layers. So in that, two are very important, that is stratum germinativum and stratum corneum. Stratum corneum is the outer layer, stratum germinativum is the inner layer. So okay, so everything whatever have, it is in the stratum germinativum. It will mitosis occur and keratin is there, mag cells is there. Mag cells will send the cells from the upper and the outer environment to the inner environment. Okay, and we have stratum corneum. So whatever the dead cells are there, it will replaced by stratum germinativum. So these are the things we studied. Here we have the diagram. We have epidermis and dermis. We can see the stratum corneum is the outer layer, and stratum germinativum, it is the inner layer. Okay, and mitosis occur here. And then after we talked about Langerhans cells. So what did Langerhans cells do? It will basically, they are branched like this. Here we have like that. These are the Langerhans cells, and these are the Mark cells, and these are the melanocytes. So whatever the, it will like act as a immune system. So whatever pathogen will come here through the skin, it will go to the Langerhans will attack to them. Okay, Langerhans will attack to them and will take to the lymphocytes. Then afterwards, lymphocyte what will do? They will produce antibodies according to the pathogen. Okay, this is the basic function will happen according to our immunity. And then talked about melanocytes. Melanocytes give melanin, melanocyte produce melanin, which will give dark color. So whenever we go into the dark sunny day, okay, it will happen regularly, then our skin will become dark. So why this happen? Because melanin will protect our skin layers from harmful rays which are coming from the sun. Okay, so now we talked about basic things in epidermis. Now we have to start dermis. Before starting dermis, here we have given two boxes. We will complete those two boxes. One is that we have to talk about burns. Burns means uh, the inflame of the skin to the skin. Okay, and the second is preventing skin cancer. How it is possible? Okay, two things we will study here. Burns of the skin may be caused by flames, hot water or steam, sunlight, electricity, or corrosive chemicals. So, how our skin burns? It will burn with the help of flames. Okay, hot water. Okay, suddenly you are taking hot water in a bucket of in a bucket. Suddenly, slip the bucket. Suddenly, the bucket fall into your leg. So the hot water burn the skin of the leg. Okay, steam. Okay, suddenly you are cooking in the kitchen. What will happen? Suddenly you don't know that this is very hot. You suddenly open the uh, covering of the one of the dish. Suddenly the steam come into your face. Your face burn. Okay, and suddenly sunlight. Okay, and electricity, these are the most common. Okay, and corrosive chemicals, some chemicals like acids will burn the face, the hands, legs, etc, etc. Basically, here in this box, what are the severity? According to the severity, the we give the name. According to the severity, we give the name to the burn. So in this burn, how it will protect? and how we can manage that, it will given here. Okay, so basically the first degree burn, there are first degree burn, second degree burn, and third degree burn, and the last is septicemia and shock. What will happen in first degree burn? Only the superficial epidermis is burned. So basically it is the epidermis and dermis. So whenever a hot water got onto the surface of the skin, the first layer burn. So here we have the painful. What will get, because why you have pain? Anyone can answer this question? Why we have the pain? The hot water is got on to our hands, especially on the epidermis layer. So we have pain. Why this is happening?
The
Please
medical
answer.
cell sends the signals to the receptors
Yeah,
and to the
very
nerve
good.
cells.
Very good. Very good. So basically, in the skin, we have sensory cells. Those are called Merkel cells, which have deeply attached to the sensory neuron. These are the neurons you can see here. So it will give the signal to the nerve. So nerve will produce the pain. So there's the reason we are getting the pain. Okay, very good. But the person will not get blister. Blister will not get. Blister means the watery fluid accumulation in the on the skin, in the skin. Okay, and a light color skin will appear red due to localized vasodilation. So we have not dark, light red color, right? Light red color skin will appear. Okay, why? Because the capillaries are not near to the epidermis, they are far away from the epidermis, so they are on the dermis. So that's the reason the light red color will appear. Okay, the light red color will appear. Okay, second thing, this is happen in the first degree burn. The third thing we have, vasodilation is a part of inflammatory response that bring more blood into the injured site. So why? So here we doesn't have more capillaries on the upper area called epidermis. So there's the reason no uh, not no inflammation will seen. Only what we will see, we will see that pain in first degree. We have what we have pain, and we have light redness. This is happening first degree. We will write the first degree like this. If if any patient came into your clinic, then you have to observe electricity burn. Okay, light hot water burn. So then you observe. You ask the patient if there is any pain. Yes, pain. Then you have to observe, is there any light redness, dark redness, then blister is appeared. So then you will write first degree burn. Okay, this is the medical abbreviation. Okay, next we will talk about here second degree burn. Second degree burn. What will happen in second degree? In second degree, deep layers of epidermis are affected. Another aspect of inflammation is damaged cells release histamine, which makes capillary more permeable. More plasma leaves these capillaries and become tissue fluid, which collects in the burn site, creating blisters. The burn skin is often very painful. So, what will happen in the second degree burn? If the water is very hot, the electricity have large amount of voltage, what will happen, it will enter into deep layers. Means, like example, we have two layers in epidermis. What are those? Stratum germinatum, stratum corneum. In the first degree, only stratum corneum affected. In the second degree, we the stratum germinativum affected. So what happened? Capillaries are nearby the stratum corneum. So what will happen? The capillaries will leak the plasma, okay, plasma into this area, okay, plasma into leakage will happen. So the plasma will enter into the epidermis and it will cause blister, watery bubble, okay. And because of the some part of the capillaries are affected, so that's the reason we are able to see inflammation here, some stuff of light, not mild redness color. First thing is blisters are seen. Second is mild inflammation. And third is here very painful. Not pain, but you have very pain. Okay. So it is happening second degree. So, and the third thing is, fourth thing we have to remember that whenever a cell damage occurs, cell will release histamine. Histamine, which do the inflammatory, which are the responsible for the inflammation, pain, redness, swelling, okay, unable to touch that area. So this will come under inflammation. So damaged cells release histamine. Second, we have to remember damaged cell release histamine. So what will histamine do? Histamine produce inflammation. Histamine produce pain. Histamine produce redness. Okay. So these are the things is seen in second degree burn. Okay. Second degree burn. What will happen in third degree? The entire epidermis is shattered and borne away. What will happen? The entire epidermis is shattered or borne away, and the burn may extend into the dermis or subcutaneous tissue. Often, such a burn is not painful at first if the receptors in the dermis have been destroyed. So, what will happen in third degree burn? In the third degree burn, the hot water, or in some like most of the cases in electric shock, what will happen? The electric shock will enter into our dermis region. So this area will become very blackish color. I think you've seen the cases in nearby area or in your family. So God protect us from this type of cases. Okay. So the our epidermis will become blackish color. We will not able to see like that. Okay. Why this is happening? Because our epidermis is not able to control whatever amount of electricity came here. So the cells will lose its tissue, the cells will damage and it will burn. Okay. So then dermis will affected. What will happen in in a in early hours, the patient not able to get pain. Why this is happening? Because the Merker cells are also damaged. So there is no Merker cells which will send the sensory output to the brain. So after 1 or 2 3 hours, the sensory nerves will directly approach that area and they will send the sense to the brain that there is damage that happen. You have to respond. On this response, the brain activate that area and we will get painful stimulation. Okay. So in the third degree burn, what will happen? The entire epidermis layer is burned. Okay. And we will not, the patient doesn't have pain in initial timing, then later on he will get the pain. Okay. Because of the receptors are completely destroyed. Extensive third degree burns are potential life threatening because of the loss of the stratum corneum. Without this natural barrier, living tissue is exposed to the environment and is susceptible to infection and dehydration. So, what will happen? That third degree burn are very dangerous and it will cause death. Okay, why this happen? Because if the layer the layer is exposed to the outer environment, so pathogen easily enter. Okay, pathogen will harm this area and our immune system will get down and the area will become very pathogenous, easily attackable area. Okay, bacterial infection. So in the third degree the bacterial infection is most common. Okay, and it will get into our blood and it will cause septicemia, means infection into the blood and quickly spread through the body. Dehydration may also be fatal if medical intervention does not interrupt and correct the following sequence. Tissue fluid evaporate from the burn surface and more plasma is pulled out of capillaries into the tissue space. As more plasma is lost, blood volume and blood pressure decrease. This is called circulatory shock. What will happen in burn? In the third degree burn, our capillaries also damaged, our arteries and veins also damaged. Because of that, the if the blood is come here, okay, then it will damaged, so it will lose the fluid from this area. Okay, and will evaporate. So there's the reason the blood volume decreases. If the blood volume decreases, our BP decreases. If the BP decreases, the patient will get circulatory shock. Okay, eventually the heart simply does not have enough blood to pump. Then what will the leakage will happen? If you have 5 liter water, if there is leakage, eventually gradually the water volume decreases. At last there is no water in the 5 liter can. Same thing happened into our body. If the burn happens, there is a leakage of blood volume. So gradually the blood volume decreases. So there is no enough blood to pump through the heart to the organs. Okay. So these are the things we have to remember. So that the patient will become they get heart failure and the cause of death. Okay, to prevent these serious consequences, third degree burns are covered with donor skin or artificial skin under skin grafts, so the patient's own skin can be put in place. So in the third degree, what will they do? They will do grafting. Means first thing, grafting means the person, same patient persons, if he have no burn in main area like buttocks and thigh region, okay, they will get the skin from that area and they will attach here. Gradually, the skin will attach to that area and no infection will occur. Mild infections will occur, but they will eventually treated with antibiotics in the hospitalization. Okay, so here we have the diagram. Normal skin here. It is the normal skin, stratum corneum, stratum germinatum, and here dermis. In the dermis we have arteries, veins. Okay, in this first degree burn. Okay, the inflammation occurs, mild redness are seen. In the second degree, we have blisters. Why this is? Because arteries, veins are also affected. They will leak the plasma, and we have blisters. In the third degree, the germinativum, epidermis, everything will damage here, and easily the arteries and veins release this plasma into outside environment. Okay, so these are the things happens during burn. We have to remember. Okay, next thing we have to study about that preventing skin cancer, common sense and sunscreens. Anyone can get skin cancer, and most important factor is exposure to sunlight. Light skinned people are, of course, more susceptible to the effects of ultraviolet rays, which may trigger mutations in living epidermis cells. So, why the skin cancer happens? It is most common due to the exposure of harmful rays from the sun. Okay, what type of rays are that? UV rays, ultraviolet rays. So, whenever the ultraviolet rays is uh, putting on the skin, okay, and exposed to the skin, so what will happen? Gradually, the skin cells have nucleus have DNA and RNA. So basically, the ultraviolet rays will damage the DNA and RNA. They will not able to produce mitosis. So then the only dead cells are present on the skin. Okay, new cells cannot be able to generate. So gradually the dead cells will are are there only. Okay, they are not able to come out of the environment due to the not happening of mitosis. Okay, mitosis not happen. So gradually will our body immune response system will activate, and it will not able to send those dead cells out from the body, and they will convert it into the cancer cells. So this is the reason of the skin cancer. Most of the cancer, squamous cell carcinoma and basal cell carcinoma are the most common form of skin cancer. Here, the given basal cell carcinoma it is okay, and melanoma. Okay, are most common form of skin cancer. The lesions are visible change in the normal appearance of the skin, and a biopsy, microscopic examination of a tissue specimen is used to confirm the diagnosis. How the diagnosis is confirmed? The area will taken to the lab, and they will examine. Okay, these lesions do not metastasize rapidly and can be completely removed using simple procedures. So basically, the skin cancers will not eventually form to the other parts of the body. Okay, they will localized only. Sometimes they will become more harmful to our body. Okay, basically they are only localized. This thing we have to remember. Malignant melanoma is a more serious form of skin cancer which begins in melanocytes. So the danger form of skin cancer is melanocytes carcinoma. Okay, melanin in the melanin cells are attacked in this cancer. Okay, any change in the pigment spot mole should promote a person to see a doctor. Melanoma is serious not because of its growth in the skins, but it may be metastatized very rapidly to the lungs, liver, or other vital organs. So, why the melanoma cancer is very danger? Because if they occur in melanocytes, because it will become metastatized, means it will easily go to the lungs, it will easily go to the liver, it will easily go to the vital organs. So whatever important organs are in the or in our body, like heart, liver, okay, stomach, intestine, whatever, kidneys, brain, okay, it will be affected. That's the reason melanocyte carcinoma is more danger than other skin cancers. Okay. Researchers are testing individually vaccines for people who have melanoma. The purpose of the vaccine is to stimulate the immune system strongly enough to prevent a second case. First such recurrence are often fatal. So, what the researchers are doing, scientists, they are producing vaccines. Okay, vaccine will trigger the immune system. Our immune system will fight alone from this kind of cancers. Although the most common form of skin cancer are readily curable, prevention is better strategy. We cannot and we not want to say out the sun altogether, because sunlight may be the best way to get sufficient vitamin D. But we may be able to do so when sunlight is most damaging during the summer months. UV rays are especially intense between 10 a.m. to 2 p.m. If we are on must be outdoor during this time, dermatologist recommended use of sunscreen. So we cannot go out and we will not able to see the sun. Okay, sun is the part of our life. We have the sunrise, sunshine, sun rays onto our body. So how can we protect the sun harmful sun rays, mainly during the summer season? In the summer season here, what is given that between the 10 a.m. to 2 p.m. we have dangerous UV rays which will cause skin cancer easily. Okay, so we have to take the dermatologist's opinion of which type of sunscreen we will use to protect ourselves from the sun rays. Okay, so we have to use natural. I will advise we have to use natural sunscreen. Okay, rather than using chemicals. Okay, here the chemicals are given para-aminobenzoic acids, which will block UV rays and prevent them from damaging the epidermis. Okay, and sun protecting factor of 15 or higher consider good protection. Use of a sunscreen on exposed skin not only help prevent skin cancer but also prevent sunburn and its painful effect. It is especially important to prevent children to getting severe sunburn, which such burns have been linked to the development of skin cancers years later. So here the what is the good chemical which will block UV rays, that is para-aminobenzoic acid. PABA. PABA means para-aminobenzoic acid, which will protect harmful UV rays entering into the body. So okay, so I think we have to use sunscreens like which are more uh, organic to our body, which will not damage our skin rather than helping the skin. Okay, so here too we talked about two boxes which are very important, which are our daily life's routine, the burns and the skin cancer. Next we will talk about a dermis. In the dermis we have many things. In this uh, image you can see that we have lots of things. We have hair, okay, receptors, okay, here, and this is touch receptor. We talked about that. Sebaceous gland is there, and s- sweat gland. This is a sweat gland is there. Muscle is there, and we have multiple things. We have capillaries. These are the capillaries, red, blue in color. These are the sebaceous gland. Okay, and we have, sorry, this is the sweat gland. Okay, which produce sweat. Okay, and we have hair follicles. These are the things we have. So in the dermis, we have hair follicles, nails. Okay, oh yeah. In the dermis, we have nails also, receptors and the glands. What are the glands are present? And blood vessels are also there. Okay. Next, we have subcutaneous. So epidermis. Dermis is made of an irregular type of fibrous connective tissue. So which type of tissue is present in the dermis? We have fibrous, which is very hard and which is connective also. Irregular meaning that the fibers are not parallel but run in all directions. So the in the dermis the fibers are not in one direction, that here high like that. Okay, zigzag, sometimes parallel, sometimes horizontal, etc. Okay, but run in all directions. Fibroblasts produce both collagen and elastin fibers. Recall that collagen fibers are strong and elastin fibers are able to recoil after being stretched. So in this we have two types of fibers, that is collagen and elastin. Collagen is very hard and elastin is very, it have elasticity. Strength and elasticity are two characteristics of the dermis. So what dermis have? It has strength and elasticity. Okay, that's the reason the person become old, the elasticity and strongness of the skin will decrease. Okay, with increasing age, the deterioration of the elastic fibers causes to skin to lose its elasticity. How we become old, how we look the old, that the elasticity of present in the dermis is decreased. So there's the reason we look old in coming days, not now. Okay. However, the deterioration, okay, we can all look forward to at least a few wrinkles as we get older. So this is the truth we have to accept. The uneven junction of the dermis with the epidermis is called the papillary layer. So the junction between the dermis with the epidermis is called the papillary layer. So it is the junction. Here we have the junction. You can see that. You can see that this is the junction. This is the junction. This is the papillary layer. One layer is called there. That is papillary layer. Here is given papillary layer. Okay. Capillaries are abundant here to nourish not only the dermis but also the stratum germinativum. And we have the capillaries also. Okay. The epidermis has no capillaries of its own. We know that epidermis doesn't have capillaries. So it will be received with the help of dermis germinativum. Okay. The epidermis, okay, and the lower living cells depend on the blood cell in the dermis for the oxygen and nutrition. How the epidermis will get the oxygen and nutrition? With the help of dermis. Okay, we have to remember that. So there's the reason if epidermis damaged, so it will take more time. Okay, the dermis will heal very means very rapidly, but epidermis took days, months also to heal. Why? Because the circulation is not there. The reaching of oxygen is not there. The reaching of nutrition is not there to the epidermis layer. Okay, we have to remember that with the dermis are the accessory skin structures, hair and nail follicles, sensory receptors, and several types of gland. Okay, so they are what are the accessory structures are there in present in the dermis? There are nails, hair, sensory receptors, and other types of gland. Some of these projected through the epidermis to the skin surface, but their active portion are in the dermis. So basically, they are present in the dermis. So the hair follicles are present in the dermis. Okay, but we will see in the projection is seen in the epidermis. Okay, so here we will conclude our lecture. Okay, I think you understood today's topic. I will continue tomorrow from the hair follicles and other accessory organs which are present in the dermis. Okay, if you have any doubt, please ask.